We haven't seen the worst of it. With those words, the Premier revealed today's shocking jump in the number of COVID cases. She's issued an impassioned plea for people to show care about their fellow citizens and to follow the stay-at-home orders. Another 633 people have tested positive to coronavirus. It's the state's biggest increase of any day since the start of the pandemic. Another 3 people have lost their lives to the disease, and COVID is continuing to spread in the regions. We have a team of reporters across the state tonight. We begin in Sydney with state political reporter Ashley Raper.
From a state that set the standard to a state of despair.
Unfortunately, we had a huge increase in the number of cases.
The numbers jumped from the 400s to 633.
Out of the 633 cases, 550 are still from southwestern and western Sydney.
Every person is passing on the virus to more than one person, so we are continuing to see case numbers increase.
The death toll too has increased. 2 men in their 70s died at Nepean Hospital, while another in his 60s died at Liverpool.
We will see more admissions and more deaths if these numbers continue to increase.
Premier, what's it going to take here? Is it going to take 1,000 cases a day, 1,200 cases a day before you institute a proper stage 4 lockdown?
We rely on the advice of our health experts. We know that our lockdown is extremely harsh. We have had and continue to have the right settings in place, but unfortunately too many people continue to do the wrong thing.
Those giving the advice are leaving the door open for harsher rules.
We have ongoing discussions about what more can we do.
Have you suggested a harsher lockdown is needed and that advice has been ignored? It's a yes-no answer.
It's not as easy as that. What we do is define the problems. So we define the settings that transmission's occurring, the fact that we need to decrease mobility.
And then it's up to the Premier and the small group of ministers in crisis cabinet to decide what to do. What's unclear is how much of the health advice is followed and how much is ignored.
We believe it's incumbent upon the government to release the health advice. Let all of us understand the circumstances by which decisions are being made by the New South Wales government.
Is it now time for you to stop promising that some restrictions will ease next month?
Well, no, I think that the challenge for us is to make sure that whilst we're asking people to adhere to the strict rules, that we're also asking them to come forward and get vaccinated.
The surge in cases is incentive enough for some.
Well, with the cases today, yeah, we're very happy we've been able to come here and get vaccinated.
It's a really scary number to think that even last week when we were at 200, we were concerned about it, and now it just seems like it's getting out of hand.
Companies continue to take matters into their own hands. The Commonwealth Bank has started rapid antigen testing of their workers in hotspot areas. Ashley Raper, ABC News, Sydney.
Ashley joins us now live. Ashley, the situation now really does appear dire. Is the Premier giving any hint that tougher restrictions may be on the way?
No, she didn't, Jeremy. The Premier really put the responsibility back on the community to do the right thing, which is what she's been doing from the beginning. She insists the state is in this situation because of non-compliance. And while police and the Premier point to instances of people breaching the public health orders, there's limited explanation as to how that correlates to this jump in cases. Gladys Berejiklian is undoubtedly under increasing pressure, and this week, with rising cases, we've seen her swing between a message of despair about the cases and trying to give hope that vaccinations will lead to freedoms, well, some freedoms, next month. It's a high-wire approach, Jeremy, as the Premier desperately tries to cut through and keep people with her in this 8th week of lockdown.
Ashley Raper reporting. Hundreds of people continue to be fined every day for breaching the public health orders. Frustrated authorities say people should stop looking for loopholes. Cayman Gock is in Parramatta. Cayman, many residents in the city's west and southwest feel like they are being unfairly targeted.
Well, Jeremy, we're always hearing about these areas in daily updates, but the people who actually live here say they're not getting the help they need. One community leader telling me locals feel like second-class citizens. They want more vaccination clinics and better communication in different languages, but residents are rallying to help however they can.
A welcome meal, desperately needed essentials, hundreds of hampers.
all of it donated and destined for the neediest in isolation. The local councillor cites a saint as inspiration.
Mary McKillop, regardless of your faith, she's an Australian icon, and one statement that she said that resonates with me is never see a need without doing something about it.
These are the hardest hit areas. Almost 90% of new cases are in the hotspots.
And the particular suburbs we want to call out are Marylands, Guildford, Auburn, Greenacre, Yagoona, St Mary's and Strathfield.
Non-urgent elective surgery is being cancelled at 29 private hospitals, so staff can join the public system. More than 460 patients are now on COVID wards. 77 require intensive care and 25 are using a ventilator to breathe. A third of people in ICU are under the age of 50. The youngest is in their teens.
We know that for every one of those individuals in ICU, particularly those in the older age groups, they have a real and material risk of death.
But the community is answering the call to arms. Many in Auburn are furious this temporary clinic will shut in a fortnight.
They take away the one pop-up clinic we've got and they ignore the constant requests.
The Cumberland Council has suggested 19 sites, including here at the Granville Centre, where every day thousands of people could get the jab. But the state government hasn't taken up any of the offers.
I'm not going to sit idly by and let my residents in Western Sydney cop a kicking when we're offering up everything we can.
Western people feel that they're second-class citizens of Sydney.
Across Greater Sydney, more than 730 people have copped a fine in just one day, most for leaving their home without a lawful reason. And police are preparing for another potential protest.
It is really fringe element groups and professional agitators that appear to be involved in what's happening on Saturday.
More than 1,000 officers will be deployed to foil their plans. Cameron Gott, ABC News, Sydney.
The outbreak in the state's west is continuing to grow. There are new cases in Dubbo and also Mudgee and Burke. And in the far western town of Wilcannia, 3 cases have emerged. Bill Ormond joins us now from Wilcannia. Bill, authorities have been on high alert over a funeral that was held there last Friday.
Yeah, that's right, Jeremy. More than 100 people attended a funeral last Friday in Wilcannia. Now, those people came from across the state's west, so places like Dubbo, Walgett, Menindee, Broken Hill, all these different places. Now, a woman from Broken Hill was the first infected from the funeral. She travelled back to Broken Hill, was infectious for 3 days before she had some symptoms, realised that and got tested, and then it was discovered that she had COVID. Now, authorities feared the worst, that more cases would come from this small Indigenous community in Wilcannia, and that's come true tonight. A mother, father and a 2-year-old all testing positive and all Indigenous. It's one of the most isolated towns in New South Wales, but that wasn't enough to keep COVID-19 out of Wilcannia.
Last year we didn't have positive cases in community. Now we do, and yeah, it's pretty scary at the moment.
More than half the population of around 700 is Indigenous, and there are genuine challenges with social distancing.
We still deal with the high percentage of overcrowding. So we've got, 2 or 3 family groups in the one household.
Community leaders have been lending their voice to the response.
To ensure the safety of the people, everyone get tested.
There were 23 new cases in the Western Local Health District, and the outbreak is putting growing pressure on health services, especially in Dubbo.
We currently have 5 patients in hospital, none of those currently in intensive care, but clearly there's a growing need for patients to be hospitalised.
Add to that the loss of staff at Dubbo's pathology lab, having to isolate as close or casual contacts.
It will, though, need some samples being taken away either to Orange or through to Westmead. We've put on additional courier services and trying to fast-track that.
The ADF arrived in Dubbo today to assist with vaccinations and other roles.
If the strategy is to be successful, they have to pay attention to cultural sensitivities.
Compliance remains an issue. Police say a man whose car hit a kangaroo near Dubbo yesterday told officers he'd arrived from Queensland about 10 days ago.
He hired a car and he decided that he would travel around country New South Wales on back roads because he was sick of COVID, that he needed to get out and about.
On the far north coast, security guards have been placed outside post offices, including Byron Bay, where people have been entering without masks. Back in Wilcannia, people are hoping with the right response, the impact can be limited. Bill Ormond, ABC News, Wilcannia.
The remote outback town of Burke has recorded another case. Gary John Lysart is live for us there tonight. Gary John, this is the third infection there.
Yeah, that's right, Jeremy. Big concerns for community spread here in Burke. The third case that you just mentioned is a member of the Alice Edmonds village. It's a former Aboriginal mission on the outskirts of town. There's about 50 people that live in the 14 homes at that area, and there are big concerns for the intermingling of people in that area. But look, messaging's also a real concern out here. There are concerns that there's no single person or group that's putting themselves forward to get the message out there.
Gary John Lysart in Burke.